We are talking about spinal fusion in this sponsored segment. Here this morning to give us a better understanding is neurosurgeon Dr. Gerald Schell. Good morning.
Good morning.
Great to have you. Let's start with this. What is spinal fusion and why is it performed in the first place?
Well, spinal fusion is a very frequent operation that's done in patients with miserable pain in their back who have significant degenerative disc problems, disc herniations, leg pain. It's done when a surgical procedure is done to free a nerve up, sometimes it makes the spine more unstable, so it needs to have some support. And what a fusion does is it takes two segments of bone and it turns it into one by removing the damaged structure and then placing bone either from hip grafting or cadaver bone and then connecting them, letting them heal, connecting them with some screws, rods, or plates.
Yeah, we saw those x-rays there, and you brought just a little model here as well this morning. What are we looking at here?
Well, this is an example of the lower lumbar spine, and it shows that the rods in the back, they're attached to two screws on either side, and what those do is they will hold or immobilize the spine during the time the bony fusion heals. Usually a fusion is a slow biologic process where it takes bone without a blood supply about 3 to 6 months to heal. And during that time, the hardware, the screws and rods, will hold the spine in place to allow it to heal.
Well, again, what types of spine conditions typically require a fusion?
Patients who have had back surgeries where they have continuing ongoing pain in their back, recurrent leg pain, patients where the spine slips or traumas, and scoliosis, the so-called curving of the spine, many times would require a fusion.
And does this procedure always require the hardware you showed, screws, rods, things like that?
No, in fact, in the elderly, since the bone is so soft, many times we usually use bone alone without the hardware because the hardware can loosen much easier in soft bone and subsequently have to be removed.
And then another question for you, what factors influence then whether a fusion heals properly?
Cigarette smoking is one of the main factors. For whatever reason, cigarettes, the nicotine causes a poor blood flow to the spine, and with poor blood flow there's poor healing. Activities which are too aggressive in the immediate postoperative period, patient who needs bracing when they don't use their braces, those are some of the things that we see with healing issues.
The bottom line, if folks have any questions, they can consult you, right?
Yep, that's right.
All right, if someone wants to maybe schedule an appointment or talk more about some potential care, you can contact Schell Spinal there. There's the website on your screen and a number to call as well. And thank you for your insight this morning.